last week. His eventual opponent on the Republican side is still undecided. Finland and Sweden have officially applied to join NATO. That's despite potential retaliation from Moscow, which says any deployment of military infrastructure to both countries would provoke a response. Their bid to join the alliance must be unanimously approved by NATO's 30-member countries. And the U.S. death toll from COVID is now more than 1 million people. The announcement comes as the FDA gives its approval for children ages 5 to 11 to get a vaccine booster from Pfizer. The CDC is expected to issue its final recommendation tomorrow. So right now, kids would be eligible for a third dose at least 5 months after their first 2 shots. The FDA made its decision without consulting its independent committee of advisors, though. Tomorrow, CDC advisors will meet to discuss the plan and make a decision. So joining me now to discuss all of this is founder of Gramercy Pediatrics, Dr. Diane Hess, and distinguished professor of epidemiology at the City University of New York Graduate School of Public Health, Denis Nash. Professor Denis Nash, thank you so much for joining us. I'm really happy to have sort of a doctor and epidemiologist because I think that we can give people all the information they need. So the first question, though, is really for this age group, I'm asking both of you, is a booster shot worth it? I'll start with you, Professor.
So we know that the early version of the vaccine for the really young kids didn't really have that much effectiveness when we went into the Omicron era against infection. It still does protect against severity of disease like hospitalizations and deaths. So 2 doses of that vaccine are good, but we know that effectiveness wanes over time. And so it's something to consider going forward because these kids did not get that much of a dose of vaccine to begin with.
Dr. Hess?
I think the booster will be worthwhile. I have personally not had any patients who've been admitted for COVID to the hospital, and I think that's because I have such a high percentage of vaccinated 5 to 11-year-olds in my practice. I think that says a lot. And, as we're seeing the numbers go up again, I think that the repercussions of missing school, of getting COVID are gigantic. Like missing school for 5 days, 5 days again, 5 days again, when we know that even if it's a small percentage that it will decrease your risk of getting COVID, it is worthwhile and it is not harmful. Our mission is do no harm, and we know the vaccine is not harmful and it is effective. I didn't get one call after any of the vaccines we gave that anybody had anything more than a fever or a sore arm.
Right. But there are going to be parents who are going to be concerned, right?
Absolutely.
And we talked about this earlier, that we've heard all along that little kids really are not impacted by this virus. They don't tend to get as sick. And now, you can maybe shed some light on the process because, like I said in the introduction, the FDA made their decision without consulting its panel for approval, right? Its advisory panel. The CDC is now going to sort of do their own research. I think parents are going to hear that and go, wait a minute. This is supposed to be, every sort of T crossed, every I dotted. Why would they move forward without consulting their advisory panel? And should we be concerned about how tenacious they're being about making sure that this is essential?
Well, for me as a public health person, the ultimate committee is the ACIP committee that CDC convenes. And so I'm really waiting to see what they have to say tomorrow. But as far as the FDA is concerned, there really wasn't that much information added by the data that was presented or that FDA talked about yesterday as basing its decision on. A new booster improved immune response. Anyone would have expected that to happen. And it does appear to continue to be safe in terms of the safety profile. So the next question is this something that public health needs to consider as a recommendation? And that's what CDC is going to tell us tomorrow.
So right now, is it something that's advised? And is it advised for what child in particular would you advise this?
So right now, it's only advised for children who are high risk or immunocompromised. We'll see what happens tomorrow, on Thursday. And I think it's going to be really parental choice at this point. Because you have to remember that 75% of the children in the U.S. already had COVID at this point. So a lot of parents are just saying, well, my kid already has some natural immunity. I still believe that they should definitely be vaccinated. I still believe that the only way to see an end to this, I think COVID is with us. But to see an end to this pandemic is to vaccinate as many people on the planet as we can.
Okay. And so how key is it to get this younger age group vaccinated then to bring an end to this pandemic? Are they a factor?
Well, I think one of the, yes,
Yeah.
of course, kids are a big factor in the pandemic period, right? They are at high risk for infection like we all are, and they're connected to households that have parents and maybe extended families that are vulnerable. And so we always have to be thinking about kids. I think one of the frustrating things about the vaccines with kids so far and adults is that they don't provide the sterilizing immunity to prevent infection.
Yeah.
They prevent severe disease, which is amazing, and we're very lucky for that. But if they also prevented infection, that would make a stronger public health argument for vaccination in kids, because they could, by vaccinating kids, you could reduce the risk of elderly and other vulnerable people. And that would be a vaccine that we'd love to see.
Doctor, I see you nodding. I think that's kind of like, even though we've talked about this over and over again about that, the vaccine essentially, protects against severe illness and death. I think people cannot get over that hump. And you hear, all kinds of stories. My friend was double vaxxed and triple boosted and quadruple boosted, and they still got it.
Yeah.
Yeah,
I have a video a parent sent me of their double vax son when he got COVID during the Omicron wave, riding her Peloton because he was just delirious from being home for 8 days. But then I said back, I wrote back, this is an amazing advertisement for the vaccine. Because he's got COVID, but he's not sick, and he's riding a Peloton. And that means the vaccine is working. Your child's not in the hospital.
That's a great point. Doctor and Professor, thank you so much for joining us. Appreciate it.